Good Saturday morning to everybody. Welcome to HyperFit MD radio show, where age management is always front and center, along with Dr. Charles and Francesca Guglin. I'm Gary Byron. Well, Doc, Francesca, how are you guys? How was your week?
We're good. You're good. We're finally, excuse me, I apologize. I got some kind of chest thing. And it's not COVID.
I think everybody does to some degree. Yeah.
Well, see, that's the thing. I mean, we've gone through the doldrums. When we were coming back from Christmas, we had we worked Monday, Tuesday, Wednesday, Thursday after Christmas, the week between Christmas and New Year's, and the schedule was packed. And I'm looking at Francesca, like, come on, man. Like, you totally overbooked us between Christmas and New Year's. I mean, it's supposed to be like a mellow week.
Usually, for every place else is, yeah.
But it turned into a mellow week because everybody canceled. Every single person either had COVID or had been exposed to it. And that ran into the first 2 weeks of January. And things are starting to pick up again. So,
Good.
Yeah. I mean, we've had our office has been a ghost town the last couple of weeks, which is good. It gets me... lets me catch up on my year-end bookkeeping and all that other stuff. But by the same token, it's a clear sign of what's happening with this Omicron variant. Everybody's getting it. Everybody's exposed to it. You know.
Well, it's the most highly. I know it's the least potent, but it's the most contagious, right?
Yeah, it's very contagious.
And now they've got a new variant, right?
There's always
Is it Pi, P-I, or
oh, that would be next. Elemental P.
Flu.
You know.
I think it's a combination of flu and Omicron.
Oh, that's what is that?
But
Flucon or something.
But
like
it's
that?
but it's each generation is getting
Flurona.
is getting less and less serious or potent.
Yeah, well, there's been a number of variants between Delta and Omicron that have been isolated and have not really been virulent at all, and so they don't even bother mentioning them. They're not transmissible to a large degree, and they're not virulent. So basically, what you do is you register that variant, and then you kind of go like this, keep your fingers crossed, and you wait to see how it's going to affect people.
So you've had a good week, and even though but busy because of people postponing due to COVID.
Yeah. And, people, or for our IV practice, people are calling us a lot because they've been exposed and are feeling ill, and they want to come in for IVs, but we can't bring them in the office. You just can't do that. You can't. There's no way that you can isolate them to the. We only have a few rooms in the office, so you can't put everybody in a room, and also you can't expose staff to that kind of thing.
Do you have like one? It's by appointment? Is it one client at a time, or can you see 2 or 3 at a time?
Oh, yeah. IVs, we have 3 rooms.
Okay.
Since COVID started, I'm not mixing people. Like, you come in either with your family member or your friend, but I'm not putting you in a room with strangers.
Okay.
So I've been doing that since 2020.
Yeah.
We have a big room that we're converting into an IV room, but we can't do it yet.
I can't wait for this whole thing to be over. Really. How about we talk a little bit about this morning about the? You brought this up. Oh my goodness! I don't know, maybe a month or a month and a half ago. The Optimus machine, right?
Yeah.
So the Optimus. Are you feeling optimistic about the Optimus?
Well, whenever I hear that word, I hear about those. I think about those Transformer movies.
Wow, there's a flashback.
Yeah, well, my kids are of that vintage where they watch those movies. So,
well, all right. So, what exactly is this system?
This
Optimus
is
machine?
our new toy, and it is the Swiss Army knife of aesthetic treatment. It has everything.
Nice
It has
way to
everything,
You don't need plastic surgery anymore.
You're going to put a lot of your fellow colleagues, your plastic surgeons, out of business.
Well, they're
Good friend you are.
I know. Well, hey, look, they're what they're doing is they're charging their what's the word I'm looking for? Sort of charging their way out of the realm of aesthetics because they're charging way too much for many of their procedures, and we hear that from patients all the time. Plastic surgery community is the prices of their individual treatments, like facelifts and things like that, have skyrocketed over the last 2 or 3 years, and the aesthetic industry has really caught up in the sense that now, in a practice like ours, through a series, 2 or 3 months of what's the word I'm looking for? 2 or 3 months of stepwise treatments, you can achieve the look of a surgical facelift without the downtime here, and a third of the cost, number 2, And number three, you spread that cost out over a period of months because it's a series of it's a protocol. It's a series of treatments. And the Optimus is one part of that Optimus Swiss Army knife is one of the principal treatments that we use, which is it's called the Morpheus 8, and it is an RF micro needling machine. And so, what is RF? You might ask.
Well, I was going to ask you that in one moment. I did have a question though.
Go for it.
Prior to that, I just want to know the different things that you can do.
Yeah.
With the Optimus, and then I'll ask you about the RF because that was a question I had. But although it's your show, so if you can answer any question that you like in any order that you like.
All right, we'll go through all of the tools in the Swiss Army knife of aesthetics. There is the Morpheus 8, which we'll talk about extensively because that's really the biggest one.
Okay.
Many of the other tools in here are a part of other kind of other add-ons, that kind of thing. One of them is the name. They give these weird names for these things. One of them is called the Lumeca. That is basically, if we were on TV, I could show you these old age spots that I have on my hands, okay, and many people on their faces. This is a laser that blanches those spots and gets rid of them. The cool thing about this, it's an IPL, yeah. The cool thing about this is that most of these lasers are only utilizable with people with skin types kind of 1 through 4. There are 6 kinds of skin types. Skin type 1 is a really white person with like blue eyes, or like even a red-haired person with blue eyes. Skin type 2 is a person like a blonde person with very light skin, kind of blue-eyed. Skin type 3 is kind of a brown-eyed person with darker complexion. It goes on until an African-American with dark skin would be a level 6 skin color. And most of these lasers are only utilizable for lighter skin types. This one is tuned for people either with lighter skin types or darker skin types. So it kind of doubles in terms of the number of clients that you can use it for. And it's very helpful. Typically, you need a series of 4 to 6 treatments to get rid of the really darker lesions and that sort of thing. But it's very helpful, especially sunspots. People have been exposed to a lot of sun in their lifetime, and they have these on their face and whatnot, these kind of darker skin spots and things like that. It's very helpful for that. Another one is called the Diolaze, and that is straight up hair removal system. The cool thing about this, you probably heard of electrolysis.
Oh, yeah.
Electrolysis is where you take a charged needle and you stick it into the hair follicle and it kills the hair follicle. That hurts like the dickens, and it takes a lot of different treatments, a lot of visits to the doctor for electrolysis to get rid of hair follicles. This one is a very broad-based laser. The actual platform itself is about a 1-inch by 3-inch size, and so you can take somebody. Let's say a woman comes to you and she wants to get rid of, the hair, axillary hair. This you can kind of basically mow this hair down with this thing. You can cover a lot of space with a very short period of time, and it's also coupled with a cooling mechanism so that it cools the skin while you're doing it. So there's very little pain involved in that one at all. There's another one that's very specific to what are called telangiectasias, which are those tiny little red blood vessels like in your face,
on your
legs, okay? Yeah. That person with rosacea, it's very helpful with rosacea. Guys who drink a lot and they get those red nose, that kind of thing, it's very helpful for those kinds of things. This is very pinpoint, so it takes a lot of triggering it to get rid of kind of extensive areas of these telangiectasias. And they can be used really anywhere in the body. That's called even the legs, yeah. That's called the
varicose veins, or no.
Varicose, you really need surgery with a vascular surgeon. These are the little,
the small. They're only like a half an inch long or something.
Yeah, up to 2 millimeters.
Chuck can tell you the difference and advise you. Like this needs to be done by a vascular surgeon.
Mm-hmm. Yeah. Any blood vessel up to 2 millimeters can be used for, which is varicosities are much bigger blood vessels. That takes a much more surgical approach. And what was the other one? The Forma, right? The Forma actually is much like it's not. Forma is basically, it is a heat sensor that you place on the skin itself, and it heats the skin to cause contraction. In centigrade, body temperature is about 37 degrees centigrade. If you heat tissue up to about between 41 and 43 degrees centigrade, you achieve fractional contraction of that tissue. So you use this in places like this, underneath the neck, places like that where you have redundant skin to kind of help tighten up that skin. That's non-invasive, completely non-invasive.
They always tell you can tell a person's age by looking at their hands and their neck.
Yep, definitely.
You get all the facelifts or Botox, that you want, but those are the two areas that.
Right, hands and neck, especially hands, man.
But this machine,
yeah,
you can deceive people.
It really sounds. You're right. It sounds like the Swiss Army knife. That's a great comparison. But being a doctor, I guess you have to be a part techie too, right? Because you need to know how this machine operates, and you can have all the bells and whistles you want, but if you don't know how to obtain them through the machine,
it's all about the it's all about the person doing the treatment. It's not the machine. The machine is fantastic. It's the person doing the treatment.
But knowing its capabilities and how to and how to apply it.
Exactly.
And the difference is, because Chuck is a surgeon and he's an MD, he gets access to, for example, the needles. The Morpheus 8, you can do the whole body. But because he's a surgeon, he gets access to the larger needles, like 7 millimeters, so you can get better results. That's number one. Number two, because he's a surgeon, he can do nerve blockers, right, to eliminate the pain. And there are certain pain medications that you can put under your tongue.
Oh, boy.
But if you're not an MD, you don't get access. It's a different experience if you come to
Boy,
Chuck.
am I glad I know you guys. All right, so now...
All right, yeah.
Now I want to talk about the RF micro needling that you've met. Right. In fact, you brought that up once before.
Yeah,
so,
we mentioned it once before.
But now we added all these bells and whistles because we decided we can do everything. If we get the machine with all the bells and whistles, we can look after our patients completely.
how long did it take for you to get that, the machine itself?
You write a check and it comes in a couple
Oh,
of
okay.
weeks.
So there's no back ordering. Okay. Okay.
Yeah.
That's
Actually,
good.
that's
You're
a
lucky.
good question. That's a good question.
Yeah, everything's back ordered. So I would have figured.
Not this. Not
Okay.
this. It's made in America.
So micro needling, RF micro needling.
Yeah. So RF stands for radio frequency.
That's right.
Micro needling has been done in the aesthetics realm for many, many years. People, women especially, have spent billions of dollars every year on collagen treatments, okay? This whole concept that collagen is what we lose as we get older from sun exposure and so on and so forth. There's really only one way of creating new collagen. And you can anybody can challenge me on this. There's only one way to get deposition of new collagen in the skin, and that's through injuring the skin. Not just the skin, but any organ, okay? If you injure an organ, the way it heals is by deposition of new collagen. The way the healing process works is with injury, you get platelet deposition in that injured site. Platelets call down fibroblasts. Fibroblasts lay down collagen. Collagen is a protein that when it's initially laid down is lax, but then it interlocks and it contracts over time. So we've all experienced wounding, so where a wound you'll cut your arm, let's say, or your finger, and over a period of time you see that wound contract. It gets smaller and smaller over time. That is after collagen deposition, collagen contraction. And the third phase of healing is always neovascularization or new blood supply to that tissue. So estheticians and physicians have been using microneedling for years to create new collagen deposition. But the microneedling technique that we've been using for years is basically a handpiece with a little bit of penetration, maybe up to 1 millimeter or 2 millimeters, that causes reasonable injury, but the results are not that great. Radiofrequency microneedling, the needles themselves are up to 7 millimeters long, depending on what application you're using. And the RF part of it is that the needle itself is insulated the entire length of the needle except for the tip of the needle. So you penetrate the skin, the radiofrequency pulses, the tip of the needle heats up. So not only are you getting the piercing of the skin and the injury to the skin, but you're getting heat applied to the dermis and the fat underneath the dermis, so you get contraction of the skin and fat remodeling underneath that tissue as well. The results are remarkable.
Wow.
The results are remarkable. The protocol is typically like if you're going to do your face, let's say, it would be one treatment per month for 3 months, because what you want to see is a cumulative effect over time, because the penetration is deeper with each treatment. So you're getting a cumulative effect over time. And the results are just remarkable, what you can see in terms of wrinkles going away and that kind of thing.
And I'll bet that's where people go first, right? Their face.
Well, it's
It's what people look at.
It's the only thing we look in the mirror every day.
That's what people look at.
Right.
People are conscious of cellulite. People are conscious of their knees, the skin that's hanging on above their knees when you get to my age. your stomach, your buttocks starts dropping. So yeah, it's
Bat wings.
yeah,
Bat wings.
Oh, yeah.
Although you call them angel's wings, but
Yeah.
in medicine they've been called bat wings forever.
Angel wings when you're in front of the patient, right?
Right, exactly.
But Chuck can make it relatively pain-free.
Oh, because of this optimism
Yeah.
Because of
and his
being
expertise
being
of
a
being an
doctor.
MD. Yeah.
Yeah. Well, I mean, yeah, because as you might guess, it without treating the pain prospectively within. And go ahead.
No.
about to ask me
Finish. I do, but finish.
No, I was going to say you need to be cognizant of the fact that it hurts. You need to take care of that aspect of it before you treat somebody. And there's lots of different ways of skinning that cat.
I want to clarify something. So, there's no question that the talent and the expertise comes from the MD. But I'm confused. Can any jamoke off the street with money go out and buy this Optimus machine and you practice it on? You use this on people?
You need a medical director, though. They won't sell it to just anybody.
But isn't a medical director an MD?
Yeah.
Yes.
Yeah. So lots of practices, will have an esthetician utilizing these machines. Well, there's a doctor in the house, or a doctor or medical director somewhere in the vicinity, somewhere in the mainland United States, who is their medical director while they're utilizing the treatments. The difference here is that the company themselves will only market the specific machine that we have to somebody with surgical experience, because the protocols that we have for this Morpheus 8 go for much deeper treatments than the standard one that they sell to aesthetics practices.
Gotcha. All right. Let's talk about Morpheus.
Yeah.
How does Morpheus work?
So it works basically the way you do it. The way you do it is it depends on the part of the body that you're using it on, because certain parts of the body, for instance, on the face, typically what we do is use a topical anesthetic. Patient comes in 45 minutes before their treatment. They put a topical anesthetic on the skin. It's a cream that goes on the skin, and they leave it there for 45 minutes. They come in, and we prep their face. Now, here's where the options occur, because we can do, with lidocaine, we can basically block the nerves on their face and completely numb their entire face if that's what they want. And I would definitely, for probably the third treatment in the 3-treatment protocol, it's probably not a bad idea because the penetration is deeper. But it's fairly well tolerated with just the topical anesthetic the first couple of treatments. But it depends on the person. I mean, some people, as you well know, some people are willing to bite the bullet and go through it. The whole procedure takes about 20 minutes, 25 minutes. Other people it's no different than the dentist, right? So for me, meet me in the parking lot with something that's going to numb up my face. I'm not even going in there until my teeth are completely numb.
Oh, you get Novocaine.
Huh? Novocaine, right.
Yeah. Oh, my goodness.
Yeah.
I can't. Imagine getting a cavity filled or a root canal.
Oh, my God.
How do you not get Novocaine?
Dude, I grew up in the Marine Corps. My dad brought us to Marine Corps dentist. There was no Novocaine in the Marine Corps.
Oh, man.
Yeah.
No, Novocaine. I want Novocaine.
Yeah.
So this is primarily for the face. I mean, I know you pointed to your
It's for the face,
arms,
Yeah.
and
It's for the whole body.
it's for the whole body.
It's for the
Okay.
face. It's for the neck that you spoke about.
Right.
The neck areas.
The
hands,
angel wings and
hands, angel wings, cellulite on the
cellulite
legs.
on the buttocks.
Yeah.
and-
People who have lost a lot of weight and have lax skin in the
Oh,
abdomen.
yeah.
It's
The back.
amazing for that.
Sure. Women who've had pregnancies, right?
Yes.
And
Yeah, it's great for lax skin. So pretty much any part of the body where that is the problem, it's very useful.
Folks, you are listening to HyperFit MD, where age management is always front and center with Dr. Charles Guglin and Francesca Guglin. I'm Gary Byron. You can always give Dr. Charles a phone call. Get a question answered or set up an appointment. That's even better. It's 203-890-9777. I'll repeat that phone number, the website, and the email address more towards the end of the show. What is the downtime, the after treatment?
Good question. The key to this is that the downtime is minimal.
Oh,
As
good.
opposed to, like we talk about surgical treatments, the downtime is significant because of bruising, and you got to wait for wounds to heal and that sort of thing. It's expected that if you're going to do something like that, you're going to have 4 to 6 weeks of downtime. Basically, when you come out of one of these treatments, your face looks, sunburned a little bit, right? And then the deeper treatments, the deeper treatments are basically you look like your skin has been beat up a little bit. There's no bruising, there's no bleeding, nothing like that. Looks like
no
a bad
black eye?
sunburn. No black eye, God forbid.
I know.
Although the Morpheus does, and this is critical to the thing because this is really the only one that treats eyes, the under eye.
Yeah.
Because there's a specific handpiece that's very small for those areas. So, but yeah, the downtime is minimal. If you had it done on a Friday, you could be back to work on Saturday, and no one's the wiser.
The next day?
The next day, you look like you've been out in the sun. But like I said, if you had it done on Friday and you go to work on Monday, no one's the wiser.
Okay.
There is one that you can resurface the skin.
Yeah.
That would be the last one that you do. Like it's just to kind of change the surface of
This
your
is
skin.
magic. It's almost like it's an incredible piece of machinery
It
here.
is.
Yeah, it is. It's not cheap either.
You see an instant result.
Does it hurt?
Yeah, that's why you need the.
Well, I know. But listen, you can get blemishes on your face, or you can go to a tanning bed, and it
Yeah.
doesn't hurt. But you looked later on, you look like you've been out in the sun. So I thought I'd ask.
No, it's actually you raised a very good point. This is really good for facial acne as well. This microneedling is great for facial acne.
Scarring.
Yeah, the scarring that comes from acne scars and those kinds of things. It's really good for that. But yeah, you're talking injury to the skin, so it does hurt. But we have many, many modalities. In fact, we're in the process of getting what's called nitrox, which is, you've heard of nitrous oxide, right?
Yeah.
It's a machine that gives you oxygen and nitrous oxide, so that when you feel the pain, you just move the tube up close to your nose and it knocks you out for a few seconds, that kind of thing. So nitrox is another way of doing it. But on the abdomen areas and in the cellulite areas, we use what's called tumescent anesthesia, which is raising the skin with a little bit of lidocaine and a lot of saline. So you're infusing the tissue underneath the skin with saline and lidocaine, so that you're raising that skin up and making it very spongy. It's a perfect clay to surface to utilize this machine with, and it's pain free.
Good.
It's
Good.
pain free.
You only have a few minutes left. And I hope I'm pronouncing this right, but I wanted to make sure I at least touched upon this. Lumica?
Oh, Lumica.
Yeah.
What's that?
Lumecca.
Oh,
Lumecca?
Yeah, Lumeca is the one that we were talking about. That has that's the one that's the laser that works for skin blemishes.
You were talking about that in the
earlier.
beginning of the show. Yeah.
Yeah.
You said it's for skin blemishes like rosacea.
That's not the one that's for rosacea. That's the.
This is for spots.
This
Oh,
is
for the
brown
age
spots.
for the age
Yeah.
spots.
Okay, so that's what it's used for.
Yeah.
The question I had about that is, when you have this done and you have these treatments, is the effect permanent?
No, you need maintenance.
Like what? Like is it once a month, or and for how long? Just for indefinitely, or?
Well, for example, the laser for the dark spots, it's there forever, right? The freckles that you
Sure.
cause, it's part of your skin. So what this IPL does, it bleaches. It bleaches, so it
It's like getting your hair colored.
It
where
white out. Yeah.
Until it grows out, and then you got to get it done again.
Yeah, it lasts for a year. Lasts for
it
months to a
white
year.
outs.
Oh.
It white outs, and then you come for just a touch up.
Yeah.
Once every 6 months or once a year.
Yeah.
Oh, that's reasonable.
It's pretty reasonable. Yeah, it's not. This isn't something that comes back in a couple of weeks. I mean, you go through
And I
3
thought it did.
treatments with that, and it's good for a year. A lot of it depends on your skin color. And a darker person, it lasts longer.
Gary, now you see this.
Okay.
And soon you'll see a difference. I haven't tried it. I haven't done it here yet.
So when next time I see you, that'll be it'll be.
All right, I have to do it I'll do it in the next 2 weeks. First treatment. You'll see the progress.
And I only got about a minute and a half. Maybe we just wrap it up with going back to talking about this Optimus machine and comparing it to the Swiss Army knife and listening to it. That's a perfect analogy.
Yeah. So we spoke earlier about the whole facelift thing. So if you come to a practice like ours and an aesthetics practice like ours, Botox is the first treatment, right? Everybody wants Botox, which is fine. And Botox is critical to keeping from, if you start young enough, you don't form those forehead lines, the things that old guys like me have already that are permanent. If you start Botox early, you'll never form those lines. Then you move on to RF microneedling. You go through a full protocol of RF microneedling of your face and your neck in these areas, 3 treatments over 3 months or so. You achieve an enormous amount of tightening of those skin, of those tissues, so on and so forth. And then in an older women who lose fat and lose the infrastructure of their face, then you move on after the microneedling to dermal fillers to restore the actual anatomy of the face, restore the infrastructure of the face. You wind up at the end of that protocol, like I talked about before, 3 or 4 months of visits to the. When I say visits to the office, over 3 or 4 months, you're making maybe 4 or 5 visits to the office.
Not bad.
You have achieved an enormous amount of aesthetic improvement in the face, neck, or whatever it is you're trying to improve. And the cool thing is that you're spreading out the cost.
That is a cool thing. Really quick.
Yeah, I just wanted to mention we're launching this machine in our office on March the 3rd at 6 p.m. for an education. We have doorbusters and grand prizes.
I'm glad you bring that up because your office is at 88 Noble Avenue, Suite 105 in Milford. Again, 88 Noble Avenue, Suite 105 in Milford. Check out their website. It's hyperfitmd.com. Once again, hyperfitmd.com if you'd like to email Dr. Charles Guglin. It's cguglinmd at hyperfitmdamc.com. Not as bad as last week. I butchered it. cguglinmd at hyperfitmdamc.com. You can email him or do it the old-fashioned way. This is what I would do it. This is my generation. I just pick up the phone and call him.
Pick up the phone.
Schedule a meeting. It's not a meeting, a consultation or an appointment, after hearing what you just heard this morning. 203-890-9777. Let me repeat that one more time for you. Write this number down. 203-890-9777. For Dr. Charles and Francesca Guglin, I'm Gary Byron. Thank you so much for listening to HyperFit MD Radio Show. Until next Saturday, have a good one, everybody. So long. And she's been hearing about you for a long time. She goes, I am. But my wife is also the kind of person where can't push her. She'll do it on her own, and I'm like,
Yeah.
I learned. You
No,
know.
like I say, you can lead a horse to water, and the people who come on their own are the people who are more responsive anyway.
Well, all right, so let me just say that. I'm so freaking late. She goes, but I want to go alone to him. Because I said, I'm not going to go into the room. That's private. I go, but I'll go for my own purpose. And she goes, I'm going to go to him. But I'm going to go when I go. And I got you. So read you loud and clear. Let me just, I got a proper. All right, guys, be
See you in a
safe,
couple weeks.
drive
Be
safe.
safe.
I always look forward to this show. And I will say that.
Bye, Ryan. Thanks.
Goodbye,
Should
guys.
I remind you to text me?
Please do,
Okay.
but I will do my best to remember.
Thanks, Ryan. You're invited to our office too.
Well, thank you. Like I said, I almost brought my, but she's so awful that I didn't want to.
We'll find you another one.